Hi, you've reached like this is a voicemail. Oh my gosh.
That was the best.
All right, let's do that again. That'll be a good blooper one day. You're listening to the Mido podcast. I'm Ashley.
And I'm Megan.
And our guest today her name is Stacey. Stacey, would you like to introduce yourself?
Yeah, I'm Stacey. I currently live in Pennsylvania. I am an adult with Mito, and I also happen to be a physician.
Which is exciting. We don't really get to talk to too many adults that have Mito, especially none that are physicians. So thank you for joining us today. Could you maybe get started in telling us how your Mito journey sort of began?
Oh, I was 27 at the time, I think. I was in residency, and I'm an OBGYN, so I would have to get up really early for work all the time. And I had been sick. I had a sinus infection, and I was on antibiotics, and it was not going well. I just kept feeling worse every day. So one day, it was a weekend, I had off, and I was in my bedroom, and I walked across the hall to my office, and I got short of breath. And I thought, oh, great, here comes bronchitis, because that happens sometimes. But it just kept getting worse, and there were no signs of bronchitis whatsoever. Chest x-ray was normal, chest CT was normal, everything. So I was at work, and I saw all my patients, and then we would all meet in a conference room and just talk about everything. And as I sat there, I felt horrible. Like I was incredibly hot, and I felt like I was going to pass out and couldn't breathe well. So after we were done with our meeting, I was walking down the hall, and one of my nurse friends was at the nurse's station. So I asked her if she could take my temperature. She's like, oh yeah, sure. And then she said, just for fun, let's put the pulse ox on. So I'm standing there, and one of my colleagues walked up, and the three of us are just standing there watching this thing. My temperature was completely normal. My oxygen saturation was 81%.
Oh.
And after a few seconds, it jumped to 83%. And then it went to 85, and then it went to 87. And we were all just standing there looking at it like, all right, come on. This trend, we should be at 89 by now. And it just stayed at 87. And my temperature was done. I was still standing there with a pulse ox on, and we're just all staring at it. Like, what is going on? So that's just kind of started everything. I went to see my PCP, and they couldn't find anything. By that time, my oxygen saturation was 100%. Mm-hmm. So they gave me a breathing treatment, sent me home, and this kept happening. Every day I get up, go to work, have trouble breathing. People said I was turning blue.
Oh, wow.
They'd send me home. So every day I'd go to my doctor's office and be like, something needs to change. And they were doing all the routine tests, chest x-rays, CTs, everything. Nothing was coming up. But I was feeling horrible. It was getting worse, and I was just tired all the time. I spent my entire day in bed pretty much. It got to the point that I kept food and bottles of Gatorade next to my bed, so I didn't have to go down the steps, because by the time I got down the steps, I couldn't get back up. So that kind of started the trend of nobody believing me and thinking, it's all in your head, something along those lines. So I finally saw a pulmonologist, and this guy was really smart and could figure out anything. Mm-hmm. And he kind of had a big ego about it. Like, if anybody can figure this out, it's me. So I went to see him, and he said, I have no idea. And he said, but I want to try to help you figure it out. So he did a test called a cardiopulmonary exercise test, where you get on a bike, they hook up all of this stuff to you, and then pedal, and they monitor everything. And I didn't last very long. I don't remember exactly how long it is. I think it was like 3 minutes or something. And when I was done, I almost passed out. Like there's 3 doctors in the room all watching me, thinking I was going to code. And they were just kind of freaked out, like just standing there staring. And I don't remember much. I remember being in the room, and I remember the people in there and people talking to me, but I was so focused on I can't breathe and I'm going to fall over. So after I kind of recovered a little bit, he came and talked to me to give me the results. And he said, your lungs are fine. Your heart is fine. But you went into anaerobic metabolism almost immediately. And he said, we need to do a few more tests, just kind of rule out some other stuff. But it appears to be something metabolic. So then that opened the doors to everything else. They really checked out my heart. They checked out my brain, everything. And nothing was wrong. So, the possibility of a mitochondrial disease came up. And when I was in medical school, we spent like maybe half an hour on mitochondrial disease. That was 2004 at the time. And I think we talked about 3 or 4 different things. And with everything, they said either this is incompatible with life, or, if the baby does live, they don't make it past the age of 2. Now, so when they said mitochondrial disease, I was like, no, that's just not possible. I'm 27. This doesn't work.
Mm-hmm.
So then I started researching it more and realizing that there was this whole other world out there of all of these mitochondrial diseases. And as more tests were done and the more people I saw, little pieces kind of all fit into this puzzle of, maybe this could be mitochondrial disease.
Mm-hmm.
Did they ever do genetic testing?
I did. I had 2 sets. Finally, when I got in to see Dr. Haas after 3.5 years, we talked about everything, and he started out with one. I don't remember exactly what it was. Excuse me. There was something with mitochondrial genes, and then there was, I think, 101 nuclear genes as well. So we did that one first, and that really didn't show anything. And then later I had whole exome sequencing, and that did come up with a few things, but they were all the unknown significance. Based on all the descriptions of them, Dr. Haas thinks they probably are causing problems, and contributing in some way, because every single one of them fits with something that I have. But nothing, I don't have anything in mitochondrial DNA, so I don't have the primary mitochondrial disease.
Which I want to say before you continue on, that happens at least for our listeners, that happens very often. I think that's why mitochondrial diseases are underdiagnosed. That's why we don't hear about it very often, because if there isn't a test that says, yes, exactly this is it, then majority of people don't. You'll get that as like a I guess pre-diagnosis, like this is what it looks like, but they can't give you this is exactly what you have. So a lot of people fall into this group of, yes, it's metabolic, and yes, it's probably a mitochondrial disease, but we don't know so much about Mito that's where those people fall into. So if you're listening, just because, there's two different levels. There's the people that, yes, 100% genetically you can find the DNA of where it shows the metabolic disease. And then there's the other half of people, which is actually more than who gets diagnosed, that get that we think this is what it is because this is what the DNA is telling us, even though it's not conclusive.
Yeah, and I also have a citrate synthase deficiency, which is one of the steps of the Krebs cycle, and it is a rate limiting step. So if you can't make it through that step, then you can't do all of the rest. And then you go into anaerobic metabolism instead, and less energy, and you make lactic acid and go down that whole path. But it's very hard to explain that to people. Most doctors I see don't understand Mito at all. And usually they try to sound smart. And when I say I have a mitochondrial disease, they say, oh, which one? And I say, well, I don't have one of the ones that has a cool name or a few letters or anything. And they're like, oh, okay. So, right off the bat, they don't believe me.
Yeah.
And since we've never been able to speak to a physician that actually has Mito, how does that feel, even when you look back at like medical school and the different things? I know, I've gone into my son's dermatologist, and they've said things like, oh, we learned a little bit about that. But how does that feel to have a disease that a lot of the doctors and you being a physician just have no idea about?
It's incredibly frustrating. And as an OBGYN, it's not something that I would have ever seen.
Mm-hmm.
People don't present to their OBGYN with this weird thing. So it was a complete learning experience for me because I had to learn everything about it.
Mm-hmm.
And then you go to a doctor, and some people don't know that I'm a doctor and I'll tell everybody. So before that, most people just blow me off. They just ignore it. And, it's really frustrating because you're trying to teach them what they need to know to take care of you. Mm-hmm. And some people listen and they're receptive, and others just don't even care.
Mm-hmm.
See, I'm naive, sorry, but I feel like, and as any doctor, it doesn't matter what field you're in, and especially I think for OBGYNs, they should be taught that. Because when I was pregnant with Angie, our first signs were our ultrasounds and talking to our OB and talking about all of the prenatal stuff that I hope that someday this does become an early test that you can do. I know that they're kind of working on that right now, but I didn't even know this was a possibility to have a child with this disease. And I feel like with all the signs that we had early on, it should have been thought of, I know you can't because you need the testing, and I being on this end of the journey, I get it, but it's very frustrating to like have any doctor, regardless of what field you're in, only get, like you said, a half a day or half an hour on this disease when it takes over so many people's lives. And just the simple fact that 90% of your energy comes from mitochondria. So why aren't we learning that? Why do doctors not have a focus on that? It's frustrating as like the naive mom over here that, I don't understand.
I think now there is a little more. I don't have that kind of connection with a medical school to know exactly, but someone did tell me a story a couple years ago. I don't even remember who it was, but there was a medical student that was with a doctor who was seeing someone with a possible mitochondrial disease, and this medical student was really interested in it. And he said, we learned about this, and I just think it's amazing, and I want to learn more. Mm-hmm. So I think now they are doing somewhat of a better job, but I don't know exactly. Research is so young with mitochondrial disease as compared to something like diabetes or cancer or something that's been years and years. So I think as we learn more, then the education will get better. But I also think we need really good people who understand this to be able to teach it, as opposed to just someone who's teaching biochemistry knows a little bit about it. We need a bunch of people who can really cover the topic well.
Yeah.
I know too, just in our association with the UMDF and Dr. Haas and Dr. Navio, and just a lot of the top doctors that are specialists in this, we need this kind of younger generation of doctors coming in and getting interested in this, because I feel like many of the doctors in the field are, close to retirement age. And I know when we go to Dr. Haas, I'm always worried, he's going to say he's going to retire or something like that. It's like, there's just not that many doctors that are going into this field. And so I'm hoping, and I know the UMDF does a lot of work with medical schools and different things to try and give nurses and different, doctors that are just starting out, credits and things and different stuff for mitochondrial research and classes and things. So I just hope that there's going to be a younger generation that kind of steps into the medical field and focuses on mitochondrial disease.
Me too. And I have the same fear with Dr. Haas myself, that he's going to retire and then I'll just be completely stuck. Because in my opinion, he's the best.
Mm-hmm.
I've seen a few people and some have been really good and some have been just horrible. But Dr. Haas impressed me from day one.
Mm-hmm.
And the good thing is, that he has the fellowship.
Mm-hmm.
And actually the fellow that was with him the first time I saw him now works in Philadelphia.
Oh, that's good.
Someone that I talked to had seen her. And I had mentioned Dr. Haas to this patient, and she said something, to the doctor that's in Philadelphia. And that doctor said, yeah, of all of the people that I worked with during my fellowship, Dr. Haas was the best, and I had the best time with him, and I learned so much.
Mm-hmm. Mm-hmm.
So at least being in Pennsylvania, it's a really long trip to get to San Diego. There's someone in Philadelphia who's worked with Dr. Haas.
Mm-hmm.
So I feel comfortable, that I could possibly go see her at some point.
Mm-hmm. Mm-hmm.
So after you got your genetic testing, what happened next? Like, are you on like a Mito cocktail at all, or?
I am. I'm on the B complex, B100. I also take riboflavin, which kind of has multiple uses. Like I'm on it for mitochondrial disease, but I also have problems with migraines. And one time I saw Dr. Haas and I'd been having so many problems. And he said, increase that. I said, because that's really good for migraines too. Also ubiquinol, carnitine, vitamin C, vitamin D. I tried creatine, but had a bad side effect. I had this horrible muscle pain and cramping. So we had to stop that one. Dr. Haas doesn't know this, but I have been taking resveratrol, supposedly good for mitochondria. And also the newest one I just started was PQQ. That they think helps you to make mitochondria.
Oh.
So I'm trying it. Now, I tried NAC, but it caused so much nausea. And then I got to the point that I could barely eat. And I was also barely drinking. That's not good. I actually tried it for about a month and had the problems and stopped it. And then a month or two ago, I tried it again and had the same problems. So I think it's just a no-go for me.
Now, I know, like for Ashley and I, and we have quite a group of moms that all have children or have children that have passed with mitochondrial disease. Do you have any other adults that you're in contact with that actually have Mito, or?
There was someone, when I lived in Arizona, UMDF contacted me and said they had someone in Phoenix that might have mitochondrial disease, and I had talked to them before and they knew I lived in Arizona. So I actually talked to her for a while, and then when I moved, I lost touch. So there was her, and then actually when I was pregnant, I had a C-section. And I got there like 5:30 in the morning, and this nurse came in all excited, like running in. She said, "Oh my gosh, you're here. I've been waiting for you." And I was like, "What?" She said, "I have Mito." And she said, "When I heard about you, I said, I need to take care of this patient." It was really cool to have that.
Yeah.
I hardly ever meet anybody that has Mito. And then, I just walk into the hospital to have a baby, and there's this nurse that happens to have Mido too. That was really cool.
That is cool. So how many kids do you have?
I have one.
And are they affected?
So far, she does not seem to be. She's 4.5. And she's kind of just rocked everything. She was holding her head up when she was an hour old.
Oh, wow.
Oh, wow.
Been ahead of schedule for everything, like all of the physical development, all of the language and speech and everything. So I'm hopeful that she's okay. Dr. Haas had said he thinks there's a pretty low chance that she would get it, but I know there's always that possibility.
Well, that's good. That's good that she's not showing any signs. There's one thing that when I had Angie in the hospital, I'd never really, I held a newborn, but never really spent a lot of time with a newborn. And so my experience when I had Angie was she was just this little baby. Like, of course she can't hold herself up. But my sister recently had a baby, and the difference between holding Angie and holding my niece was crazy. Like just it was like night and day, and it gave me so many realizations to if it were to happen again today, I feel like I would know more. I would know that there was something wrong, because I didn't know. Like, she was just a little baby, but now I realize that they're a little bit more sturdy than Angie was.
When it's hard being a first-time mom. Like, I have nieces and nephews, and I help them, obviously, but it wasn't there for everything. It was just a brief half hour at a time. And even being a physician, it's not something that you really deal with. You spend a few minutes with someone and their baby, and that's it. And, I only ever saw them for 2, 3, 4 days after they were born, and then occasionally they'd come into the office again. But, I didn't see them, so it was completely new for me too. And if I didn't have Mido, I don't think I ever would have looked for anything like that, because you just don't know. Nobody knows about Mido to begin with, and then when you're a new mom, you're just so excited you have this baby, this little tiny baby, and you're trying to do everything. Doing the dishes is even something that you don't even think about. It's just everything is so new, and everything they do is exciting, and you're just like, oh, she's so cute. You don't look for certain things. Nobody's kind of trained to look for those things.
No. Yeah, and I know I've mentioned before, but one of the things with Troy is definitely he couldn't hold his head up. And I remember just going to my friends and like, is this normal? Because you don't know. And I'm like, it's taking a long time. And, thankfully we had a pretty proactive pediatrician that was like, all right, let's look into this. Let's see what's happening, instead of just dismissing it and saying, oh, well, they all develop at their own rate, and that kind of thing. So yeah, you have no idea. A couple of babies in maybe, but not that first one.
Yeah, like you said, everybody does things at a different time. So it's not by this time, all babies are going to be holding their head up or rolling over. It's kind of a range, and some fall outside that range, but they're still completely normal.
Yeah, exactly.
So what is day-to-day life like right now? Is there anything that you have to do as like precautionary, or do you know how much energy you can expend before getting exhausted?
Some days are better than others. I really try to not do anything that's going to require a lot of energy, because I know I don't have it. So I try to save it up for taking care of my daughter, because obviously she's 4.5. She can't just walk around the house and cook lunch and all that stuff. So I focus on taking care of her first. And then if I have energy to do other things, then I will. I'm horrible at doing laundry, because I don't have the energy to do 3 or 4 loads of laundry in a day. And I can't tell you how many loads of laundry I wash 2 or 3 times, because I put it in the washer, and by the time it's done, I'm like too exhausted to get up and put it in the dryer. So I really have to focus on, I need to get this done. I need to have the energy for this, which causes problems when you have a child, because my daughter wants me to go outside and run around with her and, spin in circles and jump and play and just be crazy. And I can't do that. And it's very hard as a mom to let your child down.
Yeah.
So that's tough.
I do the same thing with laundry, but it's because I forget that I put it in the washer and then I have to wash it a few more times.
I was thinking the same thing when she said that. I thought, oh my gosh, I totally do that. It'll be late at night and I'm just exhausted from all the entire day and walking Troy around, and it's just like, oh my gosh, it's 9 o'clock. Oh, I put laundry in. Oh, well, we'll wash it again tomorrow morning.
I don't even get that excuse. I literally walk in and I'm like, oh man, I forgot it again. And then I smell it to see if it smells bad or not.
Exactly. Can this just go in the dryer or do we need to rewash?
But it is hard. It is different when you have something like Mito to compete with, because it's true. Even something as what other people would see as easy isn't, and it is really hard. It's laborious. It's difficult to just walk into the laundry room or wherever you have your laundry at, and a lot of people don't realize how much energy it takes to squat down or bend over or pick up stuff. And when you're tired, I mean, trying to put it for our listeners that don't have Mito, let's say you run a marathon and then we tell you, okay, as soon as that marathon is over, you're going to have to go and clean your house now, do everything, or even just do, like you said, the laundry or the dishes, putting those things away. Your muscles are tired. All the energy has been expended. Another way to think of it too is you need like electrolytes or something to give you your body that break, to give it that extra boost. And when you have Mito, that doesn't happen. You can't just do that. It's not as easy as drinking a Gatorade or something like that. So it is hard. It's strenuous. I don't know what my dog is doing. Catch a fly or something. He's trying to attack the popcorn machine at the moment. I actually think he sees himself. Sorry, hold on 1 second.
Well, I was going to say too, like you mentioned, it's hard, when you have a 4-year-old and, seeing her wanting you to do these different things and you just can't do them. I know, obviously I have a child with Mido, and so he wants to do certain things that, he just gets tired. And, just walking at this point, he's 12 years old, is tiring to him. And standing up, we just did one of our first PT sessions over Zoom, of course, with a new PT, and just standing at the counter for him for about 10 minutes was just tiring. And you feel bad, you want them to be able to do, all the things that they can do. And you want to be able to go out and play with your daughter and run around. But it's just, it's disheartening sometimes to experience that in both situations. So Mito's hard. It's hard.
Yeah. And I know when I do too much, I don't always feel it right away, but a few hours later, it's just like, oh, I regret doing that. And I can tell that I'm most likely in lactic acidosis, and that sticks around for days usually. And I'm like, just actually last week, I overdid it on something. And for 4 or 5 days afterwards, I just felt horrible. And I can't tell you how much Gatorade I drank, just to try to get myself hydrated at least. Mm-hmm. It's just tough. Like everything hurts. And I honestly have compression sleeves that cover my entire legs because the myopathic pain that I have, a lot of it is in my legs. Mm-hmm. And if I have a compression sleeve on, that at least helps a little. I look like a complete idiot when I have all of them on together, but I don't go out in public like that, so at least I don't feel bad there. But yeah, it sucks.
Yeah.
Well, is there anything that you want to tell our listeners, or is there anything else that you wanted to talk about?
Really, I think the hardest part of this is that I probably saw somewhere in the range of 25 to 30 doctors before I found Dr. Haas, including 4 other mitochondrial specialists. And, most of them thought I was faking it, making it up, and some psychiatric illness. It's just stress, it's depression. For me, I was a young female in the medical field. And when someone fits into that category and they have vague symptoms and you can't find anything on test, so many doctors just say, oh, I know, it's all in her head. She's making up, she's faking it, she wants attention, whatever. So if I hadn't been a physician, I probably would have accepted that. After you hear it from so many people over and over and over again, you start to believe it. And I actually said to my husband, are they right? Am I just crazy? But he kept me going. And, being a physician, I thought, I have to look into this further. I can't just accept that nothing is wrong with me. So I think you have to have somebody to help motivate you and keep you going and kind of be your advocate and push for somebody different to see you. And even of the 4 other mitochondrial specialists I saw, the first one I saw is a good doctor. He's well known. I won't say names here because I don't want to just throw anybody under the bus. But when he did my muscle biopsy, he completely screwed it up. He didn't order the test he should have ordered. He ordered the wrong things. And then when everything came back as, this doesn't look mitochondrial, he just kicked me out. He was like, you're not going to see me anymore, basically. And then they even went to the extent that they lost the rest of my muscle. So when I finally got in with Dr. Haas, there was no muscle. They couldn't find it. So I did a second muscle biopsy. And there's people that pretend to be mitochondrial specialists and are not. I saw someone else who told me there is no way you have a mitochondrial disease. And how I wish I could go back to her today and say, oh, really? Because clearly I do. So I think, if you don't get the answer, you can't just give up. You have to keep going. And it's harder for adults than it is for children because most people think Mito is a childhood disease. And it's hard to find someone who will see an adult. And it's hard for a lot of people to even comprehend that an adult can have a mitochondrial disease because they probably also learned in medical school, it's fatal by the age of 2 or whatever. So I think, you just have to keep going. You have to find a way to not accept that there's nothing wrong with you and go see somebody else. And it was actually, I had seen Bruce Cohen when he was at Cleveland Clinic, and I really liked him. And he started the whole process, and we were getting into things. And then his nurse, for some reason, wouldn't let me come back. And then when I moved to Arizona, my new doctor called him, to try to get me in again. And that's when we found out he had moved. So I reapplied to see him. And then my husband found Dr. Haas, so I applied to see him too. And I was talking with my pulmonologist at the time, and he said, if both of them give you an appointment, go see both of them. He said, this is going to take finding the right person. And I don't know if Dr. Cohen is it, and I don't know if Dr. Haas is it, but you have to try. I ended up not getting back in with Dr. Cohen, but then I saw Dr. Haas, and he turned out to be the right person. So if I hadn't tried and if I hadn't gone, then I'd still be just stuck. I'd be just floating around out there, still trying to figure it out. And I still don't think we have the whole answer. We kind of get pieces as we go along, and we add it to the mix. But without having all of your genes sequenced, you're not going to know everything for sure.
Right.
Well, I think that's really good advice. And, it goes for adults, like you said, we're only familiar with the pediatric side of it, but, the parents have to be the advocates and have to say, no, there's something going on. So, I'm so glad that we actually spoke to you. If we have any listeners that are actually adults with Mito, that, to keep searching for that answer. And you may have to go to quite a few doctors. We hear that all the time. But if you know that something is wrong, you have to keep advocating for yourself and get the answers that you can get. Like you said, I mean, Troy doesn't have a specific genetic diagnosis either, but you have to just keep trying to figure out so that you can get the best treatment that you can for what you're experiencing.
Yeah, and even when I got some results from Dr. Haas, we were talking about all of this. And he said, even though you have papers that say you have this, you're going to go see people and they won't believe you. He said, even though you can give them proof, they're still not going to believe you. And that definitely has happened. And that alone can just beat you down. So I think even though it's hard, everybody needs to remember that what you have is real. And there are going to be people who would be jerks and not take it seriously. But then you're going to find other people, excuse me, who are awesome and who will want to learn about it and want to help you and involve you in all the decision making. Like I have doctors who, when I'm sick and I need antibiotics, they'll say, okay, you know the list of things you can't take. Which one should I give you? I give them a few that I can take, and then they are like, okay, you know what you're talking about, so I'll give you this one. And then there are others who they don't care, they don't ask.
Yeah. Well, thank you for talking with us today. We really appreciate being able to have you on our podcast.
Thank you for having me.
Yeah. And for any listeners out there, you are listening to the Mido podcast. If you have any questions or comments, please send us an email at mitopodcast@gmail.com. You can also find us on Facebook, on Instagram, and we're working on it, but we do have a YouTube as well. So again, any questions or comments, please send them to us. And thank you again, Stacey. We really appreciate you being on with us.
Thank you so much.
Thank you for this podcast you're doing too.